Hi, my name is Robert Welk, and I'm the owner of Welk Security and Trust. We're an insurance agency with a tax service that helps people that need insurance in the area of individual, group, and Medicare. The purpose of this video is to explain one of the challenges that clients have with the Washington Healthcare Exchange. It's just one of the areas that we work in, and what we can do to help you overcome that as your agent. So if you're on the main website, you hit the Apply Now button in the browse plan, it brings you to a simulator. And this simulator helps you understand as a consumer, because 68% of people buy on their own, exactly what you're looking at. So you put in the zip code of where you live, whatever that happens to be. You put in your date of birth, and then you put in your income. And then, of course, you add your family members um, to hitting this little add household member. And then it pops up and shows you the plans. Now, here's where the challenge is, and this is really important, is the simulator is trying to mathematically and objectively provide you information that you would then count on in making a decision. If the software doesn't work 100%, or you input the wrong information, the results are going to be skewed. And when they're skewed, you make a choice on that, you're stuck with that choice for the calendar year. Because most people don't use a lot of healthcare, they often won't realize that there is an issue until they're spending a lot of money in the healthcare system. So one of the things, the values that we provide to you as a client, is to help you get through these situations, to ask the tough questions, to think in a bigger picture so that you don't get burned. We also take the financial responsibility, because if I give you advice and it turns out to be wrong, that's something I'm liable for. If you get advice from the system and it's wrong, they're disclosing up front that it's just a guide, and it's your responsibility to double and triple check everything that's going on, which is very, very difficult unless you know exactly how to go about doing that. So we get, yes, help me find a plan. Okay, so now it's going to pop up here, and the first thing it's going to do is ask you to put in your doctor's names. Now, the first thing you have to be careful of is that you not only find the right provider, but the right location. Because if you're going to a location that's different than what's listed there, there's no guarantee that that's going to be covered. So you type in here, let's say Dr. Jones, and you're going to see there are lots of Dr. Joneses. And even within the Dr. Joneses are going to have different locations, okay? So let's see, is there any of them that have two locations here? No. Okay, so let's just take, for example, Roxanne Jones, right? So now she's listed here. Okay, so then it's going to ask you, the computer's going to ask you how many visits you have a year. Now, there's quite a variance from company to company in terms of how many visits they cover per year. And that's why it's really important that you put accurate information in there, because most companies are going to either cover no primary care doctor's visits, or they're going to cover 4, or it's going to be unlimited. Those are generally the choices. So you want to make sure that that's accurate. And but keep in mind that if it's comparing plans that don't offer a doctor's visit, like a health savings account version, the problem is I'm not sure how the computer is going to calculate the cost on that, because the overall cost, because if you don't have coverage in that area, certainly it costs more. But if the overall premium is less, how does it calculate it unless it knows how much the doctor's visit is? That's one of the flaws that I see in the system here. Okay, so then when we enter medications in, we're going to enter some very inexpensive medications to begin with here. This is a very commonly taken drug for cholesterol, right? Then we want to go ahead and when I add another drug, now I'm going to add something that's a little more expensive here. And the reason why I'm doing this is you can't really see it here, but it doesn't have a pull down, but there are multiple versions of Lantus, okay? So when you pull Lantus up here, you see where it shows you the dosages, and it doesn't tell you, it isn't asking how many you're taking, right? So for example, if a guy takes a Lantus pre-filled pen, which is the Lantus Solastar, he could be taking 3 a month, 5 a month, 10 a month, and each one of those pens are a couple $100. So I'm not sure how the computer can accurately predict that, because it just doesn't have all of the data. And that's one of the questions that I prompt clients is how often because I'm trying to compare multiple systems of multiple companies, how often are you filling those prescriptions? And if you say you don't know, then I'm going to say we need to get that information before you make a decision. But if you're doing this on your own and you just mark it and it turns out to be wrong, or you don't have the dosages right, well, then you're in a tough spot because you can see right here, it didn't ask you how many vials that you're filling, right? So then you come down here and it says, so then it asks you on average, how many prescriptions does each of your members plan to take this year? I'm not sure why that's pertinent because if you're taking 7 or more generic medications that are $3 to $5 versus, you know, 2 or 3 medications that are $500 a month, the computer, there's no way for it to tell because it's just kind of making this rough estimate because it has no idea if you're taking a brand or generic, and the variation between generic and brand is huge. So I just don't think it's a very accurate indicator of cost. So then you hit choose a plan, and then it immediately comes in and tells you that this is the best plan for you. Now, again, if for some reason this doctor wasn't in network with coordinated care and it said that it was, then how does the computer calculate that, right? Because essentially you'd have to pay full price. In addition to the cost of a full price visit, which of course we don't know what the cost is, then you also have the secondary question, which is, would I still be able to get access? Because if your primary care physician is not in a network with this particular company, you can't get a referral to their specialist because all referrals have to go through the primary care physician. So now everything's 100% out of pocket. So when we did our audit, just of the doctors, we're in the process of doing that right now, and then we're going to do it on the prescriptions. We found that in the doctors, there were several companies that were as high as 25%, where, you know, if you looked what was on the Smart Finder through the Washington Healthcare Exchange, and then you looked on the carrier's website, there was a 25% variance. And I'm not saying that's the case with coordinated care or Ambetter. I'm saying that with some of the carriers. So what I'm going to recommend, and again, I'm not trying to be critical of the exchange, I'm trying to say this is important to you as a consumer, is that I'm going to suggest you use an agent because it doesn't cost you anything, it doesn't change your benefits, but they're going to ask the tough questions that you're not thinking of that could have a significant effect, and they're going to give you the right advice, and they're liable for what they're doing. And I think those are really important things, especially when it comes to something so complicated as the exchange. In addition to that, you're going to get tax advice, at least from our office, that's 100% accurate, which is another thing that affects us because, for example, if your income is such that it comes from a rental or a portion of it, the way the system is designed is it doesn't have a limit on the number that you can put in there. However, there is a limit. You know, essentially you're looking at net income, not gross. So, you know, if you have a rental that rents for $2,000 a month and you're only netting out 200 after all deductions are taken, well, then the problem is which number you're reporting. The computer is telling you to report the higher number, well, you really ought to be reporting the lower number. And that begins to not only affect your premiums, but sometimes it would affect your deductibles and your maximum out of pockets. So that's why it's important to use an agent. Appreciate your time. You can reach us at 443-5416 here in Spokane. Thanks so much.